talk about how it's been almost a year since the hurricane. It just kind of makes me reflect, and I know that you're all doing the same thing, about how grateful we are. You know, being in the place where we are now, considering all of the devastation in the communities that we serve. We were all in this mass panic when we recognized that the waters were rising outside of our homes. And then we all lost power to the outside world. We couldn't reach our employees. As soon as the water stopped and started to recede, I got in my car as the chief of operations and decided that I would just drive around Watauga County to see what the devastation was, because outside my door I could see cars running into each other and, you know, going under the water, and the little bit of phone conversation that I had with folks, I knew that it was going to be devastating, but I had no idea until I got out in my car and rode around to see what was happening. So I came to each one of the sites in Watauga County the best that I could. Lines were down all over the roads. The police were out. People were outside in shock, looking at their yards. That Monday, almost everybody showed up. Some people could not get out of their driveway, so of course they could not come, and we were frantically trying to find telephone numbers, Parker, right, and addresses, so that those of us who did have vehicles that could get out could check on these folks. And it took us a good week and a half, 2 weeks, to find every single person to make sure that they were okay. I remember how we just all said, okay, what do we do? You know, I remember you specifically, let's get the medicine to whomever needs it. We're not going to worry about all the logistics. If somebody says that they have lost their meds, we're going to get it to them. You know, we had so many folks show up to work that didn't have power, that had small children at home. They didn't know where their cars were. Some of their cars had been washed away. But they still came to this organization to support patients, to support people who needed help. Our providers, behavioral health, dental, medical, wanted to show up for the community, and that's just a beautiful thing. There were no plans. We just did it. And the employees that were here, if they could show up, they did. And it was just a beautiful thing. And it's something, as devastating as it was, is something that I will never forget. And I am changed because of the people that work here and the people in these communities that we serve and what they did to help everybody, to help their neighbor. I don't know, how do you feel?
Yeah, I mean, when I think about those early days, I think the most amazing part of it was how quickly we went from absolute chaos to serving patients in whatever way we could. I mean, even that first Monday, we were able to open sites in 3 of our 4 counties. We put out a call to employees Sunday night, not knowing who had cell service and who would even get it, and just hoped that people would show up, and everybody who could get there did. And I think people just wanted to help in any way that they could. I mean, it was true heroics in that first week, the things that people did for their patients. I think there were kind of like the real outreach, amazing things that we think of when we think about first responders, people going to triage the medevac helicopters that were pulling folks out of the hardest hit areas, and people doing ride-alongs with EMS in the hardest hit areas to see if they could just help people they found on the street, people serving at the emergency shelters. But there was also a lot of heroism just happening on the phones and in the clinics. And I mean, I think that kind of commitment to the daily grind of primary care, just making sure our patients had access to their medications, if they fled a home without their meds, or if their pharmacy was closed, that kind of heroism, I think, can seem small in the moment, but made a gigantic impact for our patients. People just pulled together in an amazing, super strong way. I think we all we all saw and heard a lot of trauma. I think some of us experienced some of that trauma ourselves, and we absorbed a lot of it from our patients in those early weeks and throughout this year. But in those early days, just people pulled together to serve patients in a way that I think made a huge impact for our community.
I agree. For us in dental, it was a little bit different because we would have been the most effective at the clinic itself, and fortunately, Watauga, we had internet, we had everything that we needed to be open for emergency patients. I think one of the providers there, he was unable to get out that first day, but we were more or less, whoever could show up, like you said, did show up, and it was our job in Watauga was to see anyone from any of our counties and beyond who needed to see a dentist for whatever reason. We had some requests also for patients that lost their dentures. It wasn't just patients that were in pain, it was patients that lost things. And then the other clinics, it was amazing for me how different each county was hit. Like Burke, for example, not really structural, but power was a big issue down there. And Avery, of course, Avery Dental, just floodwaters kind of took out the whole clinic. But I'm grateful for all of the dental staff, all of the high country staff, for just those who could not get in. They weren't far behind. As soon as they could, they did. And I know that becomes a four-letter word, business as usual. I think we've had enough of that term, but it's pretty amazing considering all that happened, how quickly we were able to get back and refocus on the mission. The mission never really went away. We just had to, my theme for this last year was resilience, and we just had to, it just took on different forms every single day of that first week, and then every single week thereafter. I felt like we were the war room almost with how often we were online. As a leadership, obviously we made mistakes because we're human, but I think that we took every step that we could to be there as the leadership to support our teams. And I mean, we'll never really know if we could kind of span out and just look down in time because we're so spread apart. But it's just, I really enjoy working here. And the team itself, no matter which county you were at and how you were hit, we all pulled together. Even outside of work, Amanda, I would say her house had power, her neighbors did not. So people came, she cooked, they took showers, all of those other stories that we may not know the whole part of it. We came to work, and then we went to work when we went home. And I think that needs to be amplified. We appreciate that because it's not easy when you're facing your own level of devastation to come put yourself aside. Like you said, Leanne, and you did too, Cordelia, to just put patients first. That takes a special kind of person.
It does.
Gratitude is one word, but there's so many others. It's just a certain level of warmth that you feel that you can't really experience unless you've been through something like this with, we're a big organization, but it felt like home. Yeah. I just moved here a year and a half ago, so this was, it felt like home after seeing how we dealt with a tragedy like this.
We live pretty comfortable lives, in the counties that we serve. We all do, and we've never really been through anything like this before. As far as, a devastating flood, lives lost, and it has just been a scary thing. I'm interested, Parker, to hear about your approach and what you thought coming into this as a new employee at that time and working on the employee list to make sure that we had everybody accounted for.
Yeah. So, human resources, we took two approaches. Most of my staff were unreachable because they lived in impacted areas, but Lexi and I live off the mountain. So we got together and we was able to pull an employee list, and we just started making phone calls. She started from the bottom of the list, I started at the top of the list in alphabetical order, and we just started making phone calls. And on this list, we would just mark when we was able to check if somebody was okay. And as we went down and through this list, and as the storm got worse and worse, and as devastation got worse and worse, we were able to contact less and less people. And I know I was in contact with almost every one of you at the time, saying, do you have an alternate way of contacting employee, whoever that may be? And we had people 2 weeks that were on that list as unverified. Mm-hmm. And I very specifically remember the week after the storm, I created an employee pantry. I'm sure y'all remember the employee pantry, and decided to take supplies to Avery. Mm-hmm. Avery was very hard hit. And I remember driving up and living in Wilkes. We didn't really have a huge impact from the storm, but the higher in elevation I got, the worse the devastation become. And I remember driving into Newland, seeing the National Guard blocking off part of the road there going into Newland. And I remember going down through the detour, and I remember seeing a house in the road where it had been washed into the road. And I was like, there's just no way there's anyone in this clinic. That was my thought. There's no way there's anyone in this clinic today. And I remember pulling up and the doors opening and people coming out of the clinic to help me unload my vehicle with supplies. And I remember every one of them had a smile on their face, knowing that they had their own tragedies, knowing that they had seen tragedy, and knowing the hours of driving that some of them had to make to get there, to detour around. It was very incredible. It was incredible to see the vast majority of the staff there working, helping patients, giving out supplies to the community. It was incredible. As a new employee at the time, I think the camaraderie and the teamwork and everyone coming together was the most impressive for me. I think anyone who's a new employee at the time got to see something incredible. Tragedy, yes. But within tragedies, we get to see everyone at their best. Yeah. I'm a believer in that. Mm-hmm. And I believe that we got to see our employees at their best performing in the worst of times.
Mm-hmm. I was so struck by the leaders, right? We talked about us sitting here as leadership in this organization, but the leaders that rose in those days and weeks following the hurricane, it is indescribable, right? We cannot put into words the amount of work that our team did. Very early on, I think it was my first shift actually at the Red Cross shelter, and I was there. One of our medical providers was there at the time, sort of different hours, but everyone was there together, and another team of medical providers and medical assistants and maybe a front desk person shows up at the shelter with a box of lunches. Not for us. I don't even think they knew we were there. It was for the other community members volunteering and working at the shelter at the time. And they're like, oh, you're here too, right? And this incredible team of ours just literally loaded their personal vehicles with cases of water and lunches from local restaurants, toilet paper, literally everything that someone could need, and went out and just started driving around the community to drop things off, right? No one instructed them to do that.
Just took it upon themselves.
They took, right, because sure, the clinics, right? We tried to staff the clinics. We wanted to be a safe space if folks needed to come to us, but most people didn't need to come to us. We needed to go to them. Right. And I think that's what we do best at High Country Community Health.
we go to the people who need our help.
Weeks after that, you saw bulldozers, excavators coming up, no one asking for money. People coming from Charlotte, Florida, New York with heavy equipment, not for recognition or money. You know, our employees did the same thing. Our employees showed up not for recognition or money, and that's a perfect example of that.
So Burke County, I want to talk about Burke County just a minute, and I know that you played an awesome role for the whole organization, not just in Burke County, and so we're grateful to you for that. But I think about Dr. Joe Hansen and his team, and I have a funny story to tell. Somebody called me, and it may have been Nicole Montalongo, I'm not so sure, but she said, she always calls me boss, and she said, boss, I'm calling because I just want to let you know what's going on down here. We may not be seeing patients in the office, but Dr. Joe Hansen and Wanda, and I'm sure I'll not name somebody that was there, but it was a team of folks that work there in Burke County. They're on a helicopter pad, and just like what you were talking about. And I said, under no circumstances should any of our team members get on that helicopter. I said, I'm so worried about that. And she said, well, it's too late. She said, they're going over, they're helping to bring people back. And I said, okay, all rules are off. We're not going to worry about it. They're doing great things. But, I couldn't get to Burke County. A lot of us just couldn't get there. But I know you were there in the thick of that, and you, I'm sure, have great stories to tell.
Yeah, so we were in Burke County, so a little bit farther down the mountain, but our biggest problem, just like you guys had, was communication, right? So all the cell phones were down, we couldn't get a hold of people. You had to drive into the city of Hickory to get cell phone service, just to get calls out. It was wild to think about, just not being able to communicate. So with that being said, and this circles back to what you said, we didn't have a plan. Of course we didn't have a plan, but working with the people that we work with at High Country really shows how professional they were in the situation, because in my experience, you really see true colors when something tragic happens, just as this. And so it was, everybody just stepped up. There was no game plan, and they just did it. And so for us in the pharmacy, coming in on that Monday, we realized we had not had power for the entire weekend, which meant that we lost all of our drug inventory, which was tragic for us because we had tried to order extra, anticipating power outages. What I didn't really foresee at the time, and I believe that I had gotten a phone call from you, Alicia, a provider at the emergency shelter, and there were so many questions coming in, like, my power's out, is this medication still good? How long is this good for? And just being able to be that resource. And so I think that's where we all really shined, was everybody, while they may not have had the answer, they knew who to call, and they knew who could give them the answer to help the patients.
I think when we think about the amazing things our employees have done, we have not just been first responders, but as an FQHC, I think this year we've learned about the importance of being the last responders.
That's right.
That, we think about the weeks after and the amazing things that our staff did and the heroic acts, but this has not ended for us or for our patients. I think we all still can think of patients who are living in hotel rooms or tents, people who lost everything, lost their family members, had severe trauma emotionally from the storm. And as an FQHC, we know that an event like this, it hits our patients who are already most vulnerable the hardest. The patients who are already living on the margins and who really needed us have needed us even more this year. And I think, rightly so, we give so much credit to the folks who stepped up in those early days, but I also just want to highlight that this work, primary care and a safety net, which is always so hard, has been so much harder this year. And I think our employees have really stepped up, but it has not been easy. I know, particularly for the dental staff.
Yeah, I agree. I like that last responders. Honestly, Avery Dental, that clinic, doesn't exist right now. We're rebuilding, but more importantly, back to the theme of resilience, we had 3 different versions of what we needed to do to be back to seeing patients. Obviously, the first one was the school bus that we have, the mobile unit that we had, that fortunately we decided to bring from Avery County to Watauga weeks before this thing happened. So we're very grateful that we were able to redeploy the unit. Otherwise, I mean, that parking lot was destroyed. So that was the first instance. And then obviously we piggybacked on the Avery Medical. Like, we became one big family. Like, integration took form in a very real way when we came and cohabitated with Avery Medical. And so the bus was the first version where we even got, you guys graciously allowed us to use an exam room to be able to see patients inside, because what happened after Helene was not a great winter. So, and so from the mobile unit, we got that trailer that was definitely an upgrade, but still not ideal. So the whole Avery team, and again, the great thing about that team is that we've had no turnover. Like, they have stuck together. This has kind of solidified their bond as a team. Dr. Johansson, AJ Johansson, had just started post-dental school in August. 6 weeks later, he is in South Carolina, escaping with his wife, his 4-year-old at that time, and then his 2-month-old. And so 2 weeks later, less than 2 weeks later, he was back on the mountain, ready to work, ready to help in any way that he could. And so was the rest of the team. One, I think, was able to go to Burke because he had to go to Burke to stay with relatives. He went to work in Morganton at Burke Dental in the meantime. So everybody just really wanted to get back in there. And then now we're in our 3rd temporary location. So just shout out to that particular squad. Although everyone had a part to play, and a very important part to play at different versions, I mean, I would be remiss if I didn't highlight the Avery Dental team for, again, their resilience. Nicole and
Agreed.
it's
And
been
speaking
fantastic.
of that, can you tell us about how Avery Dental's doing? Like, what's the status? What's the update on that?
Well, it's been a long journey. You've been part
It's been a
of
long
some of
journey.
those, meetings. I don't know if we could actually, in connection with federal and state entities, I'll just say that. It's just been a long process to rebuilding. There's a lot of red tape when you talk about working with federal and state entities. Somebody talked about a climate now, so it's a slow build, but we are rebuilding. I think getting into that 3rd location put some of the pressure off because it's an actual building. And we have that sense of normal. I hate, we're only 5 years out of this thing and we're starting to say new normal. I'll say that because everybody knows what that means. But we're still a few months away, hopefully. We hope to reopen 504 by the end of the year. And not just that, but we hope to expand, because with this, just like with the pandemic, it's created this even wider margin of patients that need to be seen. We've lost pretty much we lost a hygienist. And so being able to expand to kind of restaff and rebuild and hopefully catch up is always the plan, because Avery County is the smallest by population, but in terms of dental, and I'm not sure about medical, but it's definitely the highest need. And so we're excited. And the team is still here and kicking, and I'm very excited.
So the one thing I would like to give accolades for with dental, and I think you've done such an amazing job, I think we can all agree to that, is even though you have a huge waiting list, and you do, and it's not, something that I know your team is working on, you always manage to see in Avery County and in other counties, so especially in Avery County, the ones who truly have emergent needs. You've never told me no when we've had somebody call and say, I have this bad tooth, I need to get in, I'm sorry, you always make a way. And wow, that's very impressive.
Yeah. Then of course, I've said that before, but I'm just going to reiterate that, like Avery Medical, that whole team, Julia, Priscilla, all of that team has just been, we thought it would be an imposition, and it ended up being such a great relationship. Jose, and also Heather, who works front desk there, was actually front desk at Avery Dental, and then we did not want to let her go because we wouldn't have any way to put her. So just able to work with other departments to find a place where it'll be mutually beneficial. That was also something that I didn't mention, but that was great that she was able to craft in so well with the team. But yeah, everybody was willing to be resilient and just focus on the mission.
So, Stephanie, I know that, y'all are still working through some things too, and you've come up with some plans on, if and when a tragedy ever happens again, so that maybe you don't lose all of those medications. I know you've come up with plans, but you also have a great team. Do you want to talk about your team really quickly?
Absolutely. So we do have battery backups installed so that we don't have to go through the process of wasting all of our drug inventory that was refrigerated. But our delivery driver, Jimmy, did such a wonderful job. We talk about how dramatic our landscape changed up here and the amount of roads that were washed out, that he was on those roads. If there was a patient who needed meds and it was a 2-hour detour, he was taking them. He was making sure that they were getting their meds. And I remember one day, Lynn, you got a call from a patient who was in need of supplies, foods. And you gave me a call, and I asked Jimmy, I was like, can you get to this location? And he's like, absolutely. And so he met you.
We got it together, and he met me, and he took it to him, and that gives me chills. I'm glad you mentioned that.
I know, so he really went out of his way to make sure that people got meds.
I think that the road was closed, and somehow he found a way to that patient.
He's not a no person. Yeah. He finds a way.
I love that. These are the things when we get so bogged down in the mundane and the things that are happening, in this organization, gets really, really hard sometimes. These are the things that brings me back to center, to know the team that we have and how great High Country Community Health is. And your behavioral health team, amazing. I know we didn't bring them up. Is there anything that you want to say?
I think the thing with the behavioral health team as a whole is in the initial days and weeks following, it felt like there was a little bit less for us to do, right? We were there, we were talking to folks, we weren't doing intensive behavioral health services at that time, right? That's not even clinically appropriate. But we were playing with kids and painting fingernails.
That's the story we love.
And just chatting, right, with folks and listening, right? That was the important thing. We were there to listen. And now, as weeks and months have gone by, this is when we shine, right? The behavioral health team is there doing trauma treatment with patients. We have built this incredibly robust school-based mental health program. Shout out to Dr. Combs and her team for starting this program in Avery and Watauga counties, literally the month, essentially, that we had this devastation. And immediately we had employees who had no sort of clinics, no homes in Watauga County, they were out for 4 weeks. In Avery County, they were out for 6 weeks. And so then to go back into the schools and to be working with the school community and folks who just experienced so much loss, right? Kiddos who maybe started kindergarten at the beginning of COVID, and that was devastating, to just a handful of years later being out for 4 or 6 weeks as a result of this loss. And many of whom still can't even get to their homes because bridges are still out, driveways are still washed. This is when the behavioral health team continues to just step up to the plate and be the safe space for our patients.
We've done, I think, a really good job supporting our community in this first year. And what we know now is that this is going to shape our community forever, that the events of Helene have altered what we're going to see in primary care. And I think we all know this has changed our work. And we're here to support our community and the people who need us, no matter what happens over these coming years. And I'm just really grateful to know we have a team at High Country that's ready to step up with whatever comes.